I feel like she's backup support, and she helps me to organize, and she gives me strategies on how to deal with a serious illness. But she doesn't just dismiss it. She gets it. She gets where we are. And I think that when I look at all of Faith's caregivers, the one that has made the biggest difference for our family as a whole, and we have caregivers at Harvard and Cincinnati, we've got them all over. We've got amazing team at Mott. She's the one caregiver that's made the single biggest difference in our lives. And so I'm super excited that she's agreed to do this today. And I'll turn it over to her. So Dr. Kris.
Thank you. I'm honored to be here, and I am humbled by your kind words. So I appreciate it. I do not have screen access. So if somebody in the control room can give me access, I will get started. While I'm waiting, let me see. Oh, here we go.
Did you get a pop-up? Okay, great.
Good. All right. Let's do this. Maybe? Okay. Very good. So I'm Dr. Kris Kullgren. I'm a psychologist at Mott Children's Hospital, and like I said, super honored and excited to be here to talk about how we move forward as families with the trauma that you may or may not have experienced with your child's illness, and moving forward to a place of thriving and better coping for you and your entire family. I don't have any disclosures to report. What I do want to report is I am not the expert here. You guys are the experts. I feel like even though I have been a practicing pediatric psychologist for more years than I would like to disclose today, most of what I have learned is from meeting with families just like you, and in fact, meeting with many of you. And so, you know, I want to really highlight the fact that you guys have the power to be resilient and to be strong. And my goal today is to help you think about strategies to get there on your own. I'm going to first off take a little side trip to the beach, which I think for many of us is a happy place for those of us who've been lucky enough to be there. And I'm going to talk about the sea turtle, this little guy here. He's much smaller than he looks on your screen, I promise. And he is, stuck in this, monster human footprint as he is making his way to the beach. And I love the analogy of the sea turtle as we think about our own resilience, because these little guys have to go through so much that gets in their way on their way to survival, right? The mother sea turtle comes in the middle of the night and she digs this big nest in the sand and lays like 50 to hundreds of eggs, and then leaves them alone for almost 2 months before they hatch. And then these little guys hatch most of the time in the middle of the night, sometimes during the day, like this creature here. And then they have to traverse on their own without any help across the sand to the ocean. And when I came across this guy, I actually said to myself, this is a great video to take for a talk on resilience that someday I will give. This was 2 years ago. And as I'm watching this woman comes up and picks up the turtle and removes him from the footprint in the sand and helps him get back on his trek to the beach. And at first I was really upset by this, because I was like, oh, the turtle's not going to learn how to get there by himself. How's he going to figure out these skills that he needs to be a surviving turtle? And then the more that I thought about it, the more that I realized that, especially as humans, we often need help. We need support to survive and to thrive. And it's okay if we need somebody to give us a hand to get back on that path. And this is where I want us to start our journey to resilience. And I put up this slide really just as a reminder that you guys are all in really good company. It often feels very isolating to be the parent of a child who has a serious injury or a serious illness, but it affects a lot of people. And because it affects a lot of people and because of these experiences, trauma is not unusual in this context, and it can affect the kids who are going through the medical experience. It can affect parents and other family members. And so I want to let you know that you are not alone. So when I say trauma, what is trauma? Trauma basically is a psychological, emotional response to an event that's deeply distressing or disturbing. And so at the heart of trauma is it really is in the eye of the beholder. What is traumatic for one person may not be traumatic for another. It's a very subjective experience. And so there's a wide range of coping and response to any one event. When we talk specifically about trauma, it can come in many different shapes and sizes. Trauma can be a single event. So thinking about, a car accident, for example, where your child may be injured, chronic multiple traumatic events. So your child has a congenital heart disease and there's multiple surgeries that take place when they're young that can be sometimes experienced as traumatic. These events can often happen in a way that creates more complex trauma reactions. So these are traumas that happen repeatedly, can result in direct harm to somebody, and the effects kind of build up over time. These events can also happen within a certain time frame. So as we often see for kids who are in the hospital, it can happen during a particular phase of their illness, for example. It can be trauma in a relationship, and often in a specific setting, like our hospital setting. And the thing about medical trauma and being a parent of a child who's going through a chronic illness is that there's a lot of things that play into that experience that can make it traumatic. There's the experience that the world is not safe, right? As parents, we bring our kids into a world because we think the world is a really great place, because we think it's a place where they can thrive and survive and be safe. And having a sick kid really reminds us of our child's vulnerability and our own vulnerability. And that itself can really be rattling. Fact that there's a lot of risk involved in your child's health. This can be a realistic threat or a belief that their life may be threatened or endangered. Many of kids who are sick are receiving medical care that is high-tech, intense, and way out of the scope of a parent's practice. Many of you are not medical providers, most of you probably, and to be experiencing this world with your child where you have lost complete control to technology and all this medical treatment can be really threatening and can make folks feel really helpless. There's also this sense often of uncertainty about the illness and the course and outcome. And that sort of lack of control and not knowing which direction things are going also can really be difficult and traumatic. Seeing your child in pain and often being exposed to somebody else's injury or even death can occur, which, as you can imagine, is very traumatic. And then finally, parents having to be faced with often life-altering decisions for their child at times of great distress can be really traumatic and very distressing for parents. And so this can often lead to what we see, and you guys have had some earlier discussions about post-traumatic stress disorder and post-traumatic stress symptoms, and this is really just a review specifically about for families who have gone through medical trauma, that there often is re-experiencing of the trauma, that feeling that it just kind of pops in your mind where you can't control it, feeling like it happens again, where certain things remind you, whether or not it's a certain day of the week or month of the year, or even smells or experiences, seeing the same doctor, smelling hand sanitizer. I've heard that so many times that there's certain things that just really bring back those memories all over again. And because the memories are so difficult, parents often engage in avoidant behaviors, try not to think about it. I heard this in the self-care group yesterday, that I don't even try to talk about it, because if I talk about it, it just comes all flooding back. Having a hard time even doing things or being in spaces that will remind you, and then finding yourself engaging in avoidance. Parents talk a lot about being really revved up, anxious all the time, having a lot of hypervigilance, kind of keeping track of everything, and all of that sort of chronic and increased arousal and fear. And then some folks will experience what we call dissociation, where they don't even feel like they're part of the situation. They feel out of body experiences, and like they can't even remember parts of the admission or certain things that happened in their child's care because of that traumatic experience. And so PTSD is not uncommon, post-traumatic stress disorder, in parents of medically ill kids. We see it in about 10 to 20%. There's certainly a higher risk than kind of in the normal parent population. And we also see that a portion of parents meet partial criteria. So they may have some of those 4 symptoms, but not all of them. And parents are often referred to as the invisible patient, right? When I see kids in the hospital, I'm seeing, technically for the kid, but it's often the parent who is not the identified patient, but the one that we are concerned about because of that important link between parental well-being and child well-being. It can impact a parent's ability to cope with the demands of their child's treatment. It can lead to overutilization. So, parents, because they're so hypervigilant and worried, might take their kid to the doctor more or end up in the emergency room more than other families, or they may underuse the healthcare system because they're so afraid and avoidant. They may have a hard time building positive relationships with their children, with their medical teams, with other people, and may develop their own physical or emotional problems. I just met with a family right before I came up here, and the mom said to me, "I just hurt all over. My whole body's in pain." And so while this is really common, and we see it a lot in families, I want to reassure you guys and focus on the fact that PTSD is actually the less likely outcome, that post-traumatic growth and resiliency are what we are more likely to see, and why I'm giving this talk today. Because I want to focus on the bounce back, the resilience, and what you can do to foster that in yourself and in your own family. So I've placed up here on the screen a whole bunch of different definitions of resilience. This is one of those things that happen when you go down the rabbit hole of the internet, and I found all these great definitions, and I couldn't really just pick one, but I really want you to look at these and maybe find one that really resonates with you. What speaks to you and your family. I love the one at the bottom because it mentions the North Star, which reminded me of camp. But it's really about that bounce back, about being in the face of adversity and being able to somehow find a way through it, to find your resilience, and to be able to direct your course towards healing and recovery. And what I want to also highlight is that resilience does not mean you're without pain. This stuff still is super hard, and parents will experience horrible things with their children. And so that difficulty and distress and emotional pain will be there, but it's about figuring out how you move through it and move past it. And resilience is not a personality trait. A lot of times people are like, "Oh, well, so-and-so is so resilient. That's just the way they are." And that's not true. So, because I think when we have the idea that resilience is a personality trait, it makes us think that we don't have it, right? And so I really want you to think about the fact that it's tools and techniques that anyone can learn and develop. Even ordinary people like you and me, right? It's not just superheroes and amazing people who can do it. It's just regular folks. It's accessible to everybody. Resilience is also not easy, right? I think a lot of times we see other people who are resilient and they make it look so good, right? It's smoke and mirrors. It really takes time and intention to be able to do it and to be thoughtful. And I'm hoping that we can talk about and give some ideas for things that you in your own life are able to emulate today. This, I think, is really the most important point here. And this is that parental resilience is important, not just because of you and because we want you to be good and well, but because the family is undoubtedly the most important system that affects child resilience. So when you model resilience, you are teaching your child the skills for their life to be resilient. I had a supervisor on internship who would always use the phrase to parents that you are their teachers for life. You are. And so when you are modeling resilience, you are teaching them how to be resilient themselves. I often use this phrase when I'm talking to parents. Those of you who know me have heard this many times and are probably sick of it, but you're only as good to your kids as you are to yourself, right? It's this idea that, if you are a vessel and like this bucket here, and you have holes poked in your vessel, you're not sleeping, you're not eating, you're not coping well, all of your reserve is going to drain out. And that reserve is what you need to be able to care for your child in the best way that you know how. And so if you aren't able to patch those holes and take care of yourself, you can't take care of your child in the best way that you can. This example is often used, the idea of putting on your own oxygen mask before you put your child's mask on. The whole idea is that if there's an emergency on the plane and you guys lose pressure and you lose oxygen, if you haven't put your mask on first, you cannot help your child, right? And so it's not selfish to do that. A lot of times parents will say to me, oh, it's so selfish to take care of myself. It's not. You have to do it first in order to be able to take care of your child in the best way that you know how. And so what is the path to resilience? What is our journey through the sand to the ocean? And what can we do to get to where we need to go to be resilient? And like I mentioned before, adversity is inevitable. It'd be great if I didn't even have to give this talk and you guys didn't have to have this conference and we didn't have to have a camp for kids who struggle with their health, but we do. And what I want you guys to think about as we're moving forward in this talk is, what can you control? And so I often talk about the fact that I want you to imagine two buckets of things. There's this bucket of things you can't control. You can't control whether or not your kid is sick. You can't control their diagnosis. You can't control the doctors, the medications, many other things about their health. And so that's the bucket that we can't really focus on. We can't really do much with. But this bucket here, the bucket of things we can control, is your response. So how you move forward, the choices you make are what is going to help you to cope moving forward. And so I'm going to move into talking about some of the components of resilience and some of the things that are ideas and suggestions that may resonate with you as you're thinking about how you can yourself find ways to make yourself a more resilient parent. I'm going to talk about connection, wellness, meaning and purpose, and healthy thinking. So the most important part, I think, is really the foundation here, and that's building connections with other people. Prioritizing relationships, for example, those connections that you have with others, bringing people into your life and allowing people in who can connect with you in an empathic and understanding way so that you're not alone. People often tell me in the face of dealing with their child's illness that they really figure out who their friends are. They figure out which of their family members they can rely on, and figuring out who those people are and inviting them into your life and building those connections are really going to help you move forward in a resilient way. And a lot of times what happens with the pain of traumatic events is that people isolate themselves, right? We talked about this yesterday in the group, where it's just too painful to talk about because those emotions are just right here all the time. But that isolation, in order to protect yourself from the trauma, is detrimental towards moving forward. And whether or not that's trying to go on a date night with your spouse or your partner, or taking time every week where it's the two of you sitting down for coffee, or you try to make time for lunch with a friend, or I guess a Zoom call with your friend, but to try to prioritize connecting with people who really care about you. Joining a group, right? The team. We say it all the time here. Having a team of people that you feel connected with, and this can be some sort of group of other parents of kids who have a chronic disease. It can be through your faith-based community or other local organization. The problem with this, though, is that these are the things that take time. But this is, again, just a suggestion. You know, if there's something that will give you a sense of purpose and joy and develop meaningful connections, it might be something that helps you in your path towards resilience. And then fostering wellness, right? This is the self-care one. This is the stuff that every time I mention it to a parent, they roll their eyes and they're like, oh, self-care, really? Seriously? And it's, you know, a popular buzzword, but it's also legitimate. We have a lot of data that the better care we take of ourselves, it's better for our mental health and for building resilience. Stress is not just physical, it's emotional too. And so taking care of your body, whether or not that's exercise, eating good nutrition, sorry, I'm allergic to the fall, you know, regular exercise, even if it's just walking around the floor of the hospital, those things can help to reduce the tolls of the stress on your body. Excuse me, avoiding negative outlets. A lot of times people turn to things that aren't healthy in terms of trying to help themselves, alcohol, drugs. We get caught up in social media and other things that end up not being positive. And so trying to figure out, excuse me, what can I do? You know, are the things that I'm doing impacting my health? Is it something that's making me feel temporarily better? Is it just putting a Band-Aid on, or is it really something that's helping me? And then practicing mindfulness. So mindfulness, you can see some examples here, is a mental state achieved by focusing one's awareness on the present moment, acknowledging and accepting one's feelings, thoughts, and bodily sensations. And there's a lot of evidence, and I think you guys have addressed this in some previous groups throughout this conference. It can be really helpful in terms of relaxation, in terms of building resilience. These can be things like journaling, yoga, other spiritual practices like prayer or meditation. Excuse me. You know, focusing on things you're grateful for. All these things can be helpful, and it's really important to try to find something mindful that works for you. I often talk to parents who are experiencing a lot of anxiety about their child's health and find themselves with their thoughts moving in the forward direction, in the future, and worry about things that aren't happening in the present. And mindfulness can be really helpful to get yourself grounded and focused on what's happening right now, what's important right now, and it can be really helpful reducing anxiety. And this link here has a whole list of grounding techniques, which I think are really helpful techniques because they can help you do some mindful practice and to get achieve calm and relaxation. And I'm just going to show you a couple of different ideas here, things that are very practical and portable, which for me, practical coping strategies are usually the best ones. You're more likely to use them. It can be something as simple as putting your hands in water or holding a piece of ice, breathing deeply, really savoring the taste of something, the smell of something, listening to your surroundings, really just sitting and being focused on the sounds in the room, focusing on how your body feels. The 5, 4, 3, 2, 1 technique can be really helpful. That's where you name 5 things in the room you see, 4 things you hear, 3 things you touch, 2 things you smell, 1 thing you taste. And these are all things that you can do sitting in your child's hospital room, at home, anywhere. Some people especially folks who are really cognitive in their anxiety, where they notice their anxiety is a lot of worries in their brain, worried thoughts, find it helpful to do grounding techniques where you have to use your mind a little bit. So doing math problems, reciting something, maybe you have a Bible verse or a saying or a poem you remember from school that you can say over and over in your head as a way to ground you into the present place. An anchoring phrase, so something you just kind of, in taking like deep breaths, you say something to yourself that reminds yourself that you're calm or that you're strong, or something that is the word reminder of what you want to do. Visualizing a daily task or talking through a daily task, and all those details can get yourself in the present. So, and these mental techniques can be really helpful. And then the final set of grounding techniques that can be really helpful are soothing techniques. So this can be something as simple as picturing a happy place, a place where you feel comfortable and safe, somebody you love, being kind to yourself, sitting with a pet. That's why we love having pet therapy at the hospital, because that can be very soothing. Listening to music, touching something comforting, even just feeling the beads on your necklace or the sleeve of your shirt, and just focusing on how that sensation feels can be really helpful in grounding you in the present. And then the next category is embracing, sorry, I lost my screen here, embracing healthy thoughts. So very often we go to very negative, understandably negative places in our heads about our experiences. And it can be really helpful to think about the thoughts that you're having, whether or not they're helpful thoughts, and trying to shift to a more helpful outlook. So keeping things in perspective, focusing on your own resilience, how resilient your kid is, replacing those irrational thoughts. Very often, folks have a tendency to catastrophize, understandably so, assume that the world is out to get me. I often hear the phrase, my kid has been diagnosed with every rare disease or rare complication that happens. Thinking about better ways to think about the situation that will change how you interpret it and respond to it. Working on accepting change. So change is a part of life. Certain goals or ideas may no longer be attainable as a result of the things that are happening, and being able to accept it. The phrase I often say to myself is that it is what it is, right? Go thinking back to those buckets. What are the buckets of things I can change, and what are the things I can't? And sometimes there's things I can't change, and I have to figure out how to move forward. Maintaining a hopeful outlook. It's really hard to be positive when life isn't going your way, and when you are repeatedly faced with these obstacles, and visualizing what you want and the place you want to be rather than worrying about your fear can be really helpful in terms of moving forward. And then learning from your past. What has been helpful before? And this kind of goes back to my point at the beginning, is I've learned so much from families who are going through what you guys are going through, because you are the experts. You've learned from this. The fact that you are here shows that you are resilient, strong people, because you are able to seek support and want to learn new ways to better care for your kids. And then finally, finding purpose and meaning. There's really good research, especially out of the cancer literature, that when folks find meaning in their difficult situations, they cope better and they move forward faster. And so these are some different ways to think about finding purpose and meaning. And sometimes it's about helping other people. Very often we get stuck in focusing on our own needs and our own family's issues, that we lose sight of the fact that there's other people in our community, other people we know who might need help and support. So whether or not, it's volunteering or donating, doing something that gives you a sense of purpose in helping others. I've heard parents say, like, it was just so nice to do something that wasn't focused on myself or my kid. And they have found great purpose in that. Being proactive. So, learning about what you've experienced before, how you've experienced things, and using what you've learned to proactively plan for new challenges and stresses in your life. When you are about to face a new thing, thinking about what you've done in the past to help you get through it. And again, moving towards your goals, developing realistic goals. Sometimes when you are so focused on your child's health, you lose sight of the big picture and where you want to go as a person, where you want to go as a family, and what you value. And so making sure that you are thinking intentionally and moving forward and setting very small, realistic goals that you can accomplish. It may not be something big, like I want to go back to school. Maybe it's something small, like today I'd like to go for a walk, or I'd like to call a friend, or I'd like to watch that TV show that everybody's been talking about. It can be some small thing that moves you in the direction that you want to go. And finally, look for opportunities for self-discovery. People often find that they've grown as a result of this struggle. And so, being able to be vulnerable and learning from these experiences can be so helpful in terms of moving you forward. I think the families that I have met who do very well have really good insight into their struggles, into what has gone well, what hasn't, and how they contributed to those outcomes. And so learning from those experiences can be so powerful. And I'm going to show you next, if I can get my cursor over. So this is a model for setting up your own resilience plan based on the past things that you have gotten through. And my whole premise here is that you guys have, just the fact that you showed up today tells me that you have gotten through an awful lot. And so thinking about, and this can be something you do on a piece of paper yourself, that you map out, is thinking about in the past, what are the supports? What are the supports that kept you upright? What are the things in your life that got you through a hard situation in the past? What are the strategies that you use that keep you moving forward in your life? Sagacity, that's a crazy word for basically like what gives you hope, what gives you comfort, like what set of strategies do you use? And then solution seeking, what are the behaviors that you showed? And if you can map these out for yourself now, then when you have a new situation, when you think about what you're going through now, if you are able to use those strategies that you've used in the past, you're very likely to find the solutions to the things that you are looking for solutions for. I think often we make resilience much more complicated than it needs to be. We're trying to find new solutions, to new problems, when really so often the old solutions will work for our new problems. I talked earlier about the fact that how you are as a parent and your own resilience is so important for how your kid moves through their illness. And so being a trauma-informed parent, so being sensitive to your child's experience is really going to be important. So understanding the impact of trauma, learning how trauma impacts kids, and understanding that there's certain signs and symptoms, the things that we mentioned earlier and that have been mentioned in other talks, keeping an eye out for those and knowing how to respond to your child and support them without further traumatizing them. And then understanding the impact of your child's trauma on yourself, all will help you to be a better, more trauma-informed parent. And so then, people often ask, what can I do? Sorry, I'm losing my cursor again. What can I do to build resilience in my kids? So what are the strategies and techniques that will help my child thrive? And so these are a few things to think about as you are parenting your own child, to help them to become a resilient kid in the face of everything they're going through. First is to build empathy. So helping your child develop empathy by teaching them how to consider and visualize the struggles faced by others. So being able to put yourself in someone else's shoes and understand what they're going through. For them to be able to identify their own go-to person. Maybe it's you, but maybe it's other supportive friends, other supportive family members, teachers, spiritual advisors to help support them. Listen. We want your kid to feel like that you're not just hearing them, but you're really getting what they had to say, and that you're really tuned in to their experience. That you accept them for who they are, not pushing them in a direction they don't want to go, but instead celebrating who they are, celebrating their experiences, and helping them to become the best person that they can be. And that's going to happen through identifying their strengths. So, very often your kid with a chronic medical condition or developmental condition is not going to fit the mold. And so what are their unique strengths, and how can you help them to move forward in their life with those strengths guiding them? Other strategies to promote resilience is allowing do-overs. I love do-overs, especially when I'm playing a game or sports, because I'm really competitive. But make sure your child knows that mistakes along the way are okay. In fact, mistakes are how we learn. And so allowing them to make mistakes and make them safely, which is really hard when your kid is sick, because we want to protect them. And so very often kids who are dealing with chronic health conditions don't get the opportunity to make mistakes and to be challenged because of our tendency to protect them. And so allowing them to do this is going to build their resilience. Developing responsibility, opportunities where they can master things and can encourage their self-esteem and their self-efficacy. Again, we often try to do things for them because they've suffered so much, and what we want is that, and dream for them is that they become responsible, healthy adults, and developing responsibilities as children will help them to do that. Offering them meaningful participation, so opportunities to engage in activities they really care about. What are they passionate about, and how can we help them develop those passions in a way that matches their abilities and their skills? And then finally, teaching them problem solving, showing them how to deal with problems, and that's often going to happen by your role modeling and your encouragement. So really, you are their teacher for life, right? Teaching them how to be resilient through your own resilience. And finally, I want to wrap up and leave some time for questions if you guys would like. But I would be remiss if I didn't talk about sort of what if you're not resilient? What if you are trying all of these things and struggling as a parent? When do you reach out to a mental health provider? When do you need to be picked up out of the sand like this turtle and moved on and supported? I would say if you are noticing you're engaging in avoidant behaviors that are not allowing you to care for your child or engage in their medical care in a healthy way, if your trauma symptoms are impacting your interaction with the medical team or impacting your day-to-day functioning, or impacting your ability to parent effectively. And then of course, if there's any safety concerns, you should absolutely reach out to someone for some additional support. I want to thank you and encourage you to hopefully try some of these techniques as you move forward in your own path to resilience. And I'm happy to take some time for questions if anyone has any.
I just want to thank you real quick for knocking it out of the park. I'm getting all these private messages. Oh my gosh, she's as amazing as you said she was. So it means a lot to me. So I'm going to throw a question out there, because I know when we first got a referral to you, I thought, oh my gosh, one more specialist, like how will I ever do this? And of course, now I'm like, oh, everyone, if you have the opportunity, you have to get help. But how can parents not be afraid? Like you tell me all the time, this is a lot of hard work. And I agree that it is a lot of hard work to go through therapy, but it's so rewarding. So, what can you tell families who might see them? Because I'm hearing a lot of our families with that avoidance, that they're avoiding dealing with things. It's like the common thread that I'm hearing. So, what can you tell families about the hard work that they put in and what they get out?
Yeah, I think I just think it's so scary, right? Taking that first step. And it in many ways, I think it feels very pathological. And I think unfortunately we as a society have pathologized mental health treatment, and what that means. And I think that's one of the things I really love about my job and my field is that it's integrated into the larger healthcare system and the larger healthcare mission, that it's really about providing comprehensive and integrated care. So it's not just focusing on medical health, but focusing on the interaction between the medical health and mental health. And so I think reminding yourself about the fact that those interactions are very, very normal. We cannot separate the mind and the body. They're intricately connected. And how we are doing emotionally is going to affect how we are doing physically.
Yeah, I was amazed how helping Faith's mental health helped her physical health so much. That surprised me because I just thought this was one more specialist, to be honest with you. And obviously that's not how it turned out for us.
Yeah, and I think, it's talk to people who have done it, like, learn about what happens behind closed doors. It's really nothing special. I hate to say that about my field, but like, it's really problem focused. It's really focusing on your needs and what your values are. It's very different than like, the psychology and psychiatry you see on TV. There's no laying on couches. And like, I really don't talk a lot about feelings. It's just like, okay, well, what are we going to do? How are we going to problem solve? How are we going to?
Yeah, that's so true. You give us strategies. That's what Will said. The strategies to get through things is what the best part of it